Good afternoon. This is Colleen Hernandez. We are going to be discussing Aker Kasten's open enrollment elections for the 2020-2021 benefit year. Matthew from the group is going to say a couple of things before we jump into the benefits at a glance. Matthew?
Great, thank you. Thank you, Colleen. I appreciate it. This is Matthew McDaniel. I hope you all are doing well, and hopefully you're staying healthy and strong and keeping your patients and clients healthy and strong out there as well. But we wanted to take some time. Normally we do this meeting face-to-face, but being that we are all on lockdown in every different place of the city and county, we're having to do this a little bit more creatively. So we will be going through verbally from more Colleen's side than my side, but verbally we'll be going through some things during our time together today. And then, as I mentioned just a couple minutes ago, everything we say today will be recorded and will be going out in an email tomorrow. So just kind of giving you a whole big picture of what the process should look like. Ideally, if we had a magic wand, being that the benefits that you enroll in this week will be live May the 1st. Ideally, everybody will listen to the webinar, will review the documents, will make their elections, and then go online and enroll in the plan that they want to participate in this year, whether it's medical, dental, vision, or the new benefits that we've added this year, which are a critical illness and an accident benefit, but you'll hear about those in a moment. Ideally, everybody would be signed up and enrolled by the end of this week so that Colleen and her team can put everything into the system. We can get everything communicated out to the carriers, and then everything will be live on May the 1st for this next enrollment year. So that's ideally what we want to do. I think Andrea asked a question about whether or not we're available for questions other than in this webinar. Absolutely. Colleen is fantastic at responding to detailed questions about the policies and the benefits, so she's always available by phone, and you can always call me if you have questions as well, and I can try to direct some traffic on the information that you'll see on the screen here during Colleen's presentation. And then also in the copies that you received in that email, you have our contact information, so you can call us at any time. I just want to remind you about a couple things before I hand it back to Colleen. The benefits are yours as a full-time employee of our company. If you remember, when all of you were hired, you were brought on as variable hour employees, and the Affordable Care Act gives us an opportunity to test you over a certain period of time to see whether or not you continue as a part-time or if you trend as a full-time employee of ours. So we've been doing that. I think some of you and many of you already know how this process has been working, but essentially we measure your hours on a monthly basis, and we do that for 12 months from the beginning of your hire date. If you prove to be full-time, which is 130 hours on average or more a month, then you are invited to participate in the benefits plan. And so that would begin the first of the 14th month of your employment with us. There's a 1-month waiting period between your 12 months and the start date. So if you are already eligible for the plan from years past, and you continue keeping that full-time eligibility up, you continue to be eligible to participate in the plans going forward. As Colleen's mentioned in past meetings, and I have too, the great thing about being involved in a company issued and benefit plan is that there is a pre-tax benefit to you, which means the cost of the insurance comes out before taxes are calculated. And that gives you a little bit of assistance on your taxable income during tax season. So that's another reason why it's good if you're going to take insurance to jump in during this open enrollment period, so you can take advantage of that pre-tax deduction on your medical insurance. Remember too, with regards to the Affordable Care Act, we as a company have said we're going to measure you for 12 months, but the stipulation for that from the company side is that we then have to provide insurance for you for a full 12 months after that, as long as you continue being an active employee of our company. This last year, we made the change that that active period, once you're enrolled, is 30 days. So that means that if you're on the insurance plan right now and you take a 30-day break from a client with us, then you are going to be technically terminated from the company. You'll have insurance to the end of that month, and then you would be eligible to sign up for COBRA. So the motivation on your side should be, once you're in the group plan, to continue taking hours with our company so you can continue being full-time going forward. This cycle particular that we're in right now, there were a few caregivers that had employee benefits last year, but because they were not working enough hours in this 1920 year, they're not eligible for insurance going forward. And so it's just a caution for all of you that we really, if you want to continue receiving the benefit of being a part of our full-time staff, continue to take hours even after the case you're on ends. And at the same time, we want to provide you with hours too for those cases that are on your schedule and going forward. So let's be in contact about that because we're tracking it on our side, and we're trying to be fair and continue those benefits to as many as needed. So just kind of bear that in mind. Okay. I think that's enough on our, oh, one more thing. As far as the deductions, we deduct the premium for the insurance policy a month before it's due. So we're going to get this enrollment set up this week and next week. In the next pay period, you'll start seeing the new premiums deducted on your paycheck, okay, for whatever premiums you're enrolling in or in insurance plans you're enrolling in. So just take a note of that. You'll see a little bit of a change in your take-home paycheck, not this Friday's paycheck, but the following paycheck. You'll start seeing that, and that'll go through the calendar year. Okay. Obviously, if there are any questions, you can certainly call me at the office anytime on that side. And if you call me and ask me for a particular benefit as far as what do I get out of this, or what should a doctor's appointment cost, or what should this cost, all of that's going to go to Colleen anyways, so you can call her directly. Sorry to dump that on you, Colleen, but I know you're good for it.
No problem.
So with that, I hand it back to Colleen Hernandez, who, for you who don't know or haven't met Colleen, she works for CGI, which is our business broker for insurance benefits. She is so super fantastic at what she does, and she's a great source of help for all of you that have questions. So Colleen, take it away.
Thank you, Matthew. So a couple of things that I did want to just reiterate regarding the Affordable Care Act. The benefits that you're being offered through Aker Kasten are going to begin on May 1st, 2020. If you are eligible for benefits, then you are not going to be eligible for subsidy through the marketplace. Another thing to keep in mind is that your benefits are in place for an entire year. So you cannot come on the benefits and then just decide a month later that you want to come off or change plans. You are able to enroll or term the plan only if you have a qualifying event. Qualifying events are going to include marriage, divorce, going from full-time to part-time, part-time to full-time, you newly become eligible for Medicare, and a variety of other qualified reasons. All of those reasons must be made, I must be made aware of those reasons within 30 days of the date of the change. I will need proof of the change to come on or to come off the plan. If you have a qualifying event, it does not allow you to change the plan that you elected. So let's say, for example, I am on plan A and then I get married and I want to bring my spouse on the plan. I can't go to plan B now. My spouse can come on my plan that I already elected, plan A. So I want to make sure that everybody is very comfortable talking about the benefits, and we will just go on ahead and answer any questions, make sure you're comfortable, and we will go from there. I am happy to announce that all of the plans that you have the option of enrolling in this year are the same as the plans that you had within the last year. Also very happy to announce that the dental and the vision did not receive any kind of rate increase at all whatsoever. You may notice an increase to your medical plans I did just want to let you know that the plans did increase. Blue Cross Blue Shield gave unfortunately, a pretty substantial renewal increase. However, your company has picked up the large bulk of that increase. So you're looking at, if you were enrolled on the base plan as employee only a 75-cent approximately increase per check. So, I mean, that is generally unheard of. All right, well, let's just dive in. If you're looking at the benefits at the glance, this is going to be what we primarily talk about. We're going to go through all of the benefits. The beginning of the page just talks about the benefits that you have available this year. The second half of page 1 is a refresher that talks about how you can locate an in-network provider for both your medical and your dental. You can cover dependent children on your medical plan until age 30. Dental and vision, you can keep them on until age 26. Everybody can flip to page 2, please. We're going to talk about your 6 different medical plan options. The first plan option is going to be the 5302 plan. This plan is a Blue Options point of service plan. You do have in and out of network benefits and copays for a lot of the commonly utilized services, including a primary office visit of $30, specialist office visit of $55, an emergency room visit of $300, urgent care at $60. Anytime you see that word copay, that is all you're responsible for. On the 5302 plan, diagnostic x-rays, diagnostic imaging such as MRIs, CAT scans, PET scans, inpatient hospitalization, outpatient hospitalization, you're going to be responsible for 30% after you meet your deductible. Your deductible on this plan is $5,000 for an individual. Then you pay 30%, the remaining bill, until you reach the out-of-pocket maximum of $6,350 for an individual. You as an individual, if you have dependent coverage, will never pay more than the individual deductible or out-of-pocket maximum. Collectively as a family, you will never pay more than the family deductible or the family out-of-pocket maximum. Your out-of-pocket maximum and your deductible, they both run in a calendar year. That means that if you are currently enrolled and you have already this calendar year, 2020, incurred any kind of deductible or out-of-pocket expense, that is going to remain with you the remainder of this calendar year. That also means that come January 1st, 2021, your deductible and your out-of-pocket maximum will restart. It will revert to 0. As I mentioned, this plan does have out-of-network benefits. I highly advise you to stay within the network, though you do have the option to go out of network. It will just cost you a lot more money. One of the main differences between this plan and some of the other plans that we will talk about is that this plan has generic-only medication. You have a $10 copay for any generic medication. If you take any brand name medication, there will be no coverage. The next 2 plans that we're going to talk about are going to be the HMO 70 and the HMO 54. Both of these plans use Blue Cross's Blue Care network. These plans do have a lot of copays for the commonly utilized services, as you can see on the chart over here. A couple things that I do want to mention, that even though that these 2 plans are an HMO plan, you do not need a referral to see a specialist. It is possible that when you call a doctor's office, you tell them you have an HMO, they're going to ask you for a referral. You just need to kindly let them know that you do not need a referral, and they are more than welcome to call Blue Cross Blue Shield and confirm that information. HMO 70, you are going to be responsible for deductible and coinsurance for advanced imaging. That's the MRIs, CAT scans, PET scans. Whereas on HMO 54, you do have a copay, something to consider. Your deductible on plan HMO 70 is $5,500 for an individual, then 30% coinsurance until you reach the out-of-pocket maximum of $7,350 for an individual. HMO 54, you have a $5,000 deductible, 30% coinsurance until you reach $6,350. Neither of the plans have out-of-network benefits. However, in the event of an emergency, it does not matter where you go to seek care and treatment. You will automatically be treated as if you were in-network. However, that does not mean I have a cold, I need to see a doctor, I'm going to go to the emergency room because it's an emergency. That will not be covered at all whatsoever. However, and I hate to use this example because I understand that this may have been true and I don't want to jinx myself. If you are skiing in Colorado and you fall and you break your leg and you need to go to the emergency room and get a cast and or surgery, please go to the closest emergency room. That will be treated as if you were in network and be covered. Both the HMO 70 and the HMO 54, they offer a full drug card. That means that you have coverage for not only generic medication, but you also have coverage for any brand name drug, depending upon the tier that the medication falls under. We're going to move on to the Blue Options 3900. This is another point of service plan, just like the first plan we talked about, the 5302 plan. So this plan does offer both in and out of network benefits and uses Blue Cross Blue Shield's largest Blue Options network. This plan does have copays for the doctor, specialist. However, once you get into emergency room, urgent care, and then you're going to have deductible and coinsurance. This plan, unlike the other plans, has copays for hospital services, both inpatient and outpatient. You'll notice when you're looking at the chart that there are two different copay amounts, option 1 and option 2. Almost all hospitals within the state of Florida, with the exception of 2 teaching hospitals, they are going to be an option 1 hospital. Every hospital outside the state of Florida, those are going to be option 2 hospitals. And therefore you would pay the associated copay. This plan, the 3900, works slightly differently when it comes to your deductible. You have a $1,500 deductible per person. Once you pay that deductible, then you pay 50% coinsurance, not to exceed the out-of-pocket maximum of $6,350 for an individual, $12,700 for a family. You do have out-of-network coverage on this plan, but again, please try and stay in network whenever possible. This is the largest Blue Cross Blue Shield network, so it should not be an issue remaining within the network. This plan does also only have coverage for generic medications. The last 2 plans are going to be the 5301 and the 5782. Again, these plans are going to use the same Blue Options network. It's going to have copays for a lot of the commonly utilized services, including doctor, specialist, emergency room, and urgent care. You're going to have lower deductibles on these plans. Both the plans have 30% coinsurance and an out-of-pocket maximum of $6,350 for an individual, $12,700 for a family. They are also going to have out-of-network coverage, but again, please stay within the network. And then both of these plans also have that full drug card. So you're going to have access to generic and brand name medications. So I'm going to high-level review the plans column by column very quickly. Plan number 1, the 5302, you have the largest Blue Cross Blue Shield network, in and out of network coverage, generic only medication. Plans in columns 2 and 3, that's the HMO 70, the HMO 54. They are HMO plans. You need to choose a primary care doctor. However, you do not need a referral to see a specialist. You have a full drug card, so you can get generic and brand name medications, but you have no out-of-network coverage. Plan in column 4, the 3900, largest Blue Cross Blue Shield network, the blue options, in and out-of-network coverage, generic only medication. Last 2 plans in column 5 and 6, the 5301 and the 5782, largest Blue Cross Blue Shield plan, in and out of network coverage, full drug card. I want to draw your attention to the row that says calendar year out-of-pocket maximum. This is the absolute worst case scenario, the largest dollar amount that you will pay out of your pocket for any covered services within a given calendar year. You will notice that almost every single plan has an out-of-pocket maximum of $6,350 for an individual, $12,700 for a family, with the exception of HMO 70, which has a larger out-of-pocket maximum. So that means that that is your end-all, be-all, worst-case scenario, most amount of money you will pay. The main difference is how you're going to get there. And when it comes to prescription drugs, what's going to be covered that you need to think about when you make your plan choice. Couple things just overall in covering all of the plans. You're going to have preventative care absolutely free. You walk in, you walk out, you pay nothing. That's going to be your regular annual physical, well woman, child exams, including immunizations, mammographies, and colonoscopies, so long as they are routine preventative, absolutely free. Also, you have the option of seeing a doctor, a specialist, going to a convenient care center, which are those little centers inside of Publix has them now, CVS has them now, Walgreens. So if you go into the Walgreens the Take Care clinic over there, you're going to see a nurse practitioner. Excellent. They're able to help you evenings, weekends, things with, I think I might have strep throat, I think I might have the flu. They can give you a little swab, give you a prescription, call it over to the pharmacy, leave their office, go to the pharmacy, pick up your medication, boom, bam, done, and you're going to only pay the primary office copay. Also available on all of the plans is going to be the option to utilize telemedicine. We're going to get into that in a couple of minutes. Let's flip over to one more thing I wanted to mention on the medical benefits first. Every single plan, no matter what your responsibility is, whether you have a copay or you have a deductible and coinsurance, you will always see a significant savings if you go to the urgent care over going to the emergency room. With that being said, I would always suggest everybody to go to urgent care whenever possible. However, there are certain things that you are unable to have done in an urgent care setting. For example, if you are having chest pain, shortness of breath, or if you have passed out, please do not go to the urgent care center because they will end up sending you to the emergency room. So you just need to evaluate your symptoms and decide where is going to be the most cost-effective place for you to seek care and treatment. Moving on to page 3, this is just some educational information regarding some ways to save on prescription drugs. Walmart and Winn-Dixie, they have $4 generic medications, $4 for a 30-day supply or $10 for a 90-day supply. Publix offers free antibiotics as well as some routine maintenance medication, absolutely free. And they also have a 90-day supply of over 25 medications for only $7.50. You do not even need to have insurance in order to take advantage of these prescription drug savings programs. Another one that I did want to point out, though, is GoodRx, which is gaining a lot of popularity now that they're doing commercials. This program, you're able to see if a particular pharmacy has the medication. And then probably the more beneficial piece, especially if you're going to take either the Plan 5302 or the 3900, and you end up with a brand name drug because those two plans have generic only medication. But if there's a coupon for a brand name drug, you'll have a link and the coupon will be right there. Some of the coupons are pay no more than $10, save 50%. I mean, it is a great benefit. So I would just suggest taking a few moments before you just run off to the pharmacy and see where it's going to be the cheapest place for you to get that medication. Okay, if we take a look at the 4th page, we're going to circle back to the telemedicine benefit that I had briefly mentioned. The telemedicine benefit is embedded in each of those Blue Cross Blue Shield plans. It's going to be a $10 copay for your plans. You have access 24/7 to actual MD doctors. They're able to see you either Skype, FaceTime, over the computer, over the phone, diagnose your treatment and, diagnose your condition and determine the best course of treatment, and they can actually call in a medication to the pharmacy for you as well. I always suggest, though, prior to using this benefit, take a couple moments and complete the information online, because just like if you were to go to a brand new doctor for the very first time you are to use telemedicine, they are going to require your information. They need to know if you have any current underlying health conditions. They need to know if you're allergic to any medication. Another way that you're able to utilize this telemedicine benefit is by downloading the Teladoc app. The app is available on both the Google Play and the Apple App Store. It took me about 5 minutes to register myself and 3 children, and one of my children has had 2 surgeries and has asthma, and it still took me no longer than about 5 minutes to get all of the previous health information into the system. They make it very user-friendly, not very difficult. I'm happy to walk you through, as are any of the doctors, both teladoc.com, and here's your number 1-800-TELEDOC as well. Page number 6, just a little informational piece that talks about the top 25 diagnoses within Florida from Teladoc. If you are more comfortable with the face-to-face approach, but you still like the idea of saving some money, you may want to consider going to a Florida Blue Clinicianistas. These Clinicianistas are actually Florida Blue-owned medical centers. Depending upon the location that you go to, and there are a variety of locations now across the state of Florida, including Miami, Broward, and Palm Beach County, you can see a primary care doctor for as little as $5. Some of the facilities actually have urgent care on site and imaging. So for more information, you can call right over here, 844-302-4827. We are now on page 8, about to jump into those dental benefits. As a reminder, both your dental plan as well as the cost for the dental plan is exactly the same as last year. You have 2 different dental plan options. Plan number 1 is going to be the DHMO. Then the second plan is going to be the PPO plan. On the DHMO plan, you must pick a dentist and see that dentist. You can change the dentist at any point in time. However, you must call Guardian prior to seeing that dentist in order to change your primary care dentist. You can change the dentist whenever you like. If you call to change your dentist prior to the 15th of the month, the change will happen the 1st of the following month. After the 15th, it's going to be the 1st of the 2nd month. On your DHMO plan, there is going to be a copay schedule. Page 8 has a little chart talking about some of the highest utilized types of services and their associated charges. There is a full dental schedule available on Employee Navigator. Every time you need to go to the dentist, there's going to be a $5 copay. Then if you need a cleaning, an exam, a one-surface filling, periodontal scaling and root planting, an extraction of an erupted tooth, no charge. Other services, any other covered service, there will be an associated copay. A couple of things that I wanted to point out about this plan. When you and I say, hey, I need a root canal, that's us layman's talking here, root canal. But when a dentist says you need a root canal, that might mean you need a root canal and a this and a that and a that that make up what we refer to as the root canal. So I would suggest getting the CDT code and looking at that full copay schedule to see what you would be paying. I just don't want anybody to get the idea that, oh my goodness, all I'm going to pay is $270 for the root canal, because that is not going to be the case. On this plan, you also have orthodontia available for both children and adults. The PPO plan does not have any orthodontia coverage at all. Moving on to the PPO plan, a couple things I want to mention. Number 1, the PPO plan has a larger network of in-network dentists. In addition, you have the option of going out of network. There's a $50 individual deductible capped at $150 collectively for a family. You then are given $1,000 per person to use throughout the calendar year. Again, this is a calendar year benefit. What this means is if you have already, within the year 2020, utilized your $1,000 calendar benefit, you will have to wait until 2021 for that to replenish itself. The calendar year benefit is the dollar amount that Guardian will pay on your behalf. It is quite possible, though, that some employees could have more than $1,000 benefit, and that's because Guardian will reward overall good dental health. And so long as you've had a claim that did not exceed $500, Guardian will roll over an additional amount, anywhere from $350 to $250, depending upon if you went in network or in and out of network. Any covered preventatives, so your exam, your cleaning, x-rays, you're going to be no charge within the network. If you choose to go out of network, you may absolutely do so. You are responsible for 20% of that service. Any basic service, such as a filling, in network is 20% after the deductible. Out of network, you pay 30% after the deductible. Major services, including root canal, crowns, you're responsible for 50% after the deductible in the network, 60% after the deductible out of the network. As I mentioned earlier, orthodontia is not covered for children nor adults. Regardless of the dental plan that you choose, you will get a college tuition benefit. One of the most highly underutilized programs available to you. This program is available to you at no cost. You do need to enroll in the program in order to take advantage of it, though. Guardian will then give you 2,000 points, which equates to $2,000, to use towards a qualified beneficiary's future college education. Your qualified beneficiaries are going to include children, grandchildren, nieces, nephews, godchildren, so essentially anybody under the sun. You do need to register in order to use that benefit, though. You must register within 6 months of your plan's effective date in order to get the points for that year. Page number 9 reviews your vision benefits. This is a Guardian Vision plan that utilizes the Davis Vision network of providers. The Davis Vision network includes not only private practice chains, but also retail centers. You have both in and out of network benefits available to you. In network, you will receive the benefits right away. If you choose to go out of network, you may do so. However, you will pay 100% for the benefit. Then you'll need to submit a claim for reimbursement. You can get an eye exam every year, new contact lenses or new lenses for your glasses every year, or new frames every other year. For both frames and contact lenses, you're given a $130 retail allowance, and anything above that $130, you're given a discount, either 20% for frames or 15% for contact lenses. However, please keep in mind that there is no additional discount given at Walmart or Sam's because they're at such a reduced rate to begin with. Also, I did want to point out that if you get frames at VisionWorks, you're actually given an extra $50 allowance. So instead of $130, you'll have a $180 allowance to use. Eye exam, you have a $10 copay. The lenses for your glasses, you're going to have a $25 copay. Those lenses are going to cover the standard plastic lenses. If you choose the anti-scratch, anti-glare, transition, etc., you will have to pay an additional amount, but you do get a discount for having the Davis Vision plan. The next plan we're going to talk about is the accident plan, which is a brand new benefit being offered to you this year. You, as an employee, in the event that you are injured in an accident outside of work, will receive a lump sum of money. The dollar amount that you receive is going to be dependent upon what type of injury you sustain. In addition to getting a lump sum of money as a result of an injury from an accident outside of work, you also have a $50 wellness benefit. What this means is if you go for your wellness exam under Blue Cross Blue Shield, which is free, and you submit documentation to Guardian, Guardian is going to give you $50. You can do whatever you want with the $50. We like to think of it as a way to help eat away at the cost of the accident plan. The next brand new benefit is going to be a critical illness plan. This will also pay a lump sum in the event that you're diagnosed with a critical illness or cancer. You as an employee will have two different dollar amounts to choose from, either a $5,000 benefit or a $10,000 benefit. If you choose to cover your spouse, they get 50% of the benefit amount that you choose. Your children get 25% of the benefit that you choose. If you have children under the age of 26 and you elect the critical illness plan for yourself, please enroll your children. They are covered at no cost, but if you don't add them to Employee Navigator, I do not know they exist, and therefore they do not have coverage. The dollar amount for this plan is going to vary amongst a couple different things, including the dollar amount that you choose, who you choose to cover, and your age at time of purchase. There's a little chart on the right-hand side of page number 10 that talks about the dollar amount that you would receive. So if you have invasive cancer, a heart attack, heart failure, stroke, organ failure, the very first time that it occurs, you're going to get 100% of the dollar amount that you choose, $5,000 or the $10,000 for yourself. Guardian will actually pay the same condition for a second time, but at a reduced rate for invasive cancer, the heart attack, the heart failure, stroke, organ failure, kidney failure at 50%. It has to be a separate occurrence, so it has to be like a 6-month lap in between the first and the second, but you're able to essentially get paid double for the same thing. Hopefully it doesn't happen, but you do have the option of getting paid twice. A couple last things before I open it up for questions. As Matthew mentioned in the beginning of this conversation, all employee decisions are to be due by Friday, April 17th. The back of page 10 of your benefit guide talks about how you can go online to employeenavigator.com and register for benefits. This is what the website will look like. You're going to click login. If you're a returning user, you're going to enter your username and password. If you are a brand new user, you're going to click register as new user. You're going to enter the information asked for. First name, last name, company identifier, which can be found on the page 10 of your benefit guide, Aker, Kasten, home, health. It is case sensitive. Okay, once you plug in all of that information, it's going to then request you to choose your username and password. Your password is going to require letters, numbers, and a special character. Once you get on to the site, this is what your site will look like. You're going to click on Start Enrollment. Yep, sorry, I got timed out, so hang on one second. Let me get back in there to show you what you would see once you log into the screen. Okay, so once you log into Employee Navigator. You're going to click on where it says Start Enrollment. Open enrollment. Let's get rock enrolling. Haha. You're going to click the little green start button at the bottom of the page. You're going to review your information here. Then you're going to hit save and continue. You're going to confirm or enter your address here. Once you enter your address, it's going to validate that information for you. You need to click on use this address. It's going to check your address against postal services. The next page is going to be the dependent information. Here is where you're going to enter or confirm that your dependents are correct. If you do not have any dependents, you're going to hit save and continue. Next page it's going to take you through is the medical, and here are all of the plans and the associated costs. To enroll in the plan, you're just going to click select, scroll down and hit save and continue. If you don't want the plan, you're going to click don't want this benefit and then the reason you don't want the benefit. One more thing I do want to mention is on the benefit guide, the bottom of page 10 is going to be the most important information. If anything, keep this information. This is going to be the contact, either phone number, website, or email address for all of your carriers, including myself, Colleen Hernandez, or Debbie Rito in my office. I am going to now open up the calls for any questions that you may have. Oops. Everybody has now been unmuted. Did anybody have any questions about anything?
Hi, Colleen.
Hello.
Hi, this is Andrea.
Hello.
I just have a question regarding dental.
Yes.
It says PPO and HMO. Now, regarding HMO or orthodontic, if I need braces, should I be covered under that? Because it says PPO doesn't cover.
Correct.
Yeah.
HMO, yes. The PPO, no.
Right. Okay, that's what I got. Okay. Just wanted to make sure. And also, I couldn't log on because it's asking me for the username. I guess I have to get that set up maybe later on or tomorrow with Matthew over the phone. So I couldn't visually see what you were saying.
Right. I can give you your username individually afterwards, and I can actually send a list.
Then I can do the password.
Correct. And if you want to just give me a call right after the meeting, I can provide you your username then.
Okay. All right. So you want me to
Colleen,
call you?
Colleen, on that.
Yes. Yes, Matthew.
On that point, I talked to an employee today who said they couldn't remember their username, so they wanted to start another user account themselves. I just wanted to say to everybody, do not do that.
They cannot do that anyway, even if they wanted to. They could not.
Okay. Okay, good.
I'm so sorry. If you don't have a question, can everybody mute their line individually?
Right. There's a
lot of background noise. Sorry, somebody had a question?
Yes, good afternoon. My name is Joan Laban.
So,
I have a question about the HMO 54 and 70.
yes.
What is the difference? I was listening when you were talking about them, but I don't remember the differences.
So there are
between
a couple differences. Number one, as you look at the second page of the benefit guide, you'll notice slight differences between the copay dollar amount. You'll also
what are
see
they?
that
I don't have the brochure. I'm sorry.
Okay. It depends upon what you're talking about. HMO 70, you pay $50 at the doctor's. Right, the copay dollar amount is going to be different. Yeah, so it's going to be, I'm just going to mute so everybody can hear real quick. Okay, so on the HMO 70, the copay for the primary care doctor is $50. We're on HMO 54, it's only $40. So small little differences with the amount of the copay when you see the doctor. One of the big differences, though, is HMO 54 has a copay if you need advanced imaging, like a MRI, CAT scan, PET scan. Also, the bigger difference is going to be the out-of-pocket maximum. HMO 70's out-of-pocket maximum is $7,350, whereas the HMO 54 is $6,350 for an individual. So you're talking about $1,000 difference. Worst case scenario. It's how you get there that's going to be the difference, which is generally going to be small differences with the exception of diagnostic testing.
Okay.
Did that answer your question?
Yes, it does. That's $1,000, 1,000 reasons right there.
Right?
Okay.
Thank you.
Colleen, hi, it's Andrea again. So you said I should call you to set up the username?
Correct. Oh, and I'll give you your username. I just don't want to give it to everybody, your personal username.
I know. What's your number directly, Colleen? You're not at Aker, are you?
I am not. I am at CGI. My number is on the last page of the benefit guide. I'm also going to put it up on the screen right over here, and I'll give it to you. It's 954 637 4274.
Okay. All right, I'll give you a call tomorrow.
Perfect.
And then I can have the username set up and then select my password.
Well, have you already selected? Have you registered before?
If I've registered before?
Yeah.
Yes, I have. But then when I try,
so you're going to reset your password, and I can walk you through that tomorrow.
Okay. All right.
Hello?
All right, so I'm going to exit now.
Okay, sounds good.
Hello?
Okay, yes, I'm sorry. I have another question.
Hello?
Yes, I'm Sharon Young.
Hi, Sharon.
I already have the PPO with my deductible is $6,000. Is it the same this year or it's gonna change?
So the plans themselves are exactly the same. So hold on, I'm gonna mute everybody again. Sounds like somebody picked up. So depending upon the plan that you chose last year, the benefits themselves are still going to be the same. I don't believe that there was a plan with a $6,000 deductible unless you had family coverage, and that was what you're referring to. But the deductibles and the out-of-pocket maximums are the same this year.
Well, it's just me alone, and my deductible is $6,000. I have the Florida Blue.
What's your last name?
Young.
I believe that you have a hyphenated name, if I remember correctly.
Smith Young.
Right?
Sharon Smith Young.
Okay. So you may be referring to your out-of-pocket maximum. You're on the 5302 plan, so you're talking about your out-of-pocket maximum, which is $6,350. Right. It's different than the deductible, though. Those are two different things.
Yeah. I know. If they say I should do a surgery in the hospital or something, I have to pay that $6,300 and something dollars, right?
And then everything else, the remainder of the calendar year, would be covered in full.
Okay.
Yep.
Hello? Hello?
Yes.
Hello?
Yes.
Hi, my name is Gerline DePlena.
Hello.
How are you?
I'm well. How are you?
Okay, if I get in your insurance, how do the payment go? Is it the payment come out of my paycheck, or do I make the payment myself?
The payment will come out of your paycheck. If you are not currently on a case, then you need to talk with Matthew about how you're able to remit your portion. But yes, so long as you have a paycheck, it will be deducted from your check.
Okay. Another question. Sometime your client deceased pass away, and then it takes you a while to get the client. How do we pay the
Yep. In the beginning of the call, Matthew mentioned that you are able to continue the insurance while you are placed on another case. You cannot have more than a 30-day break, though, in the coverage, and then you would pay make arrangements with Matthew to pay your portion directly.
Okay,
If
so
you
do
don't
you
have a
have
check.
all my information with you?
Matthew does.
Okay, so
Yeah,
should I call
Gurleen,
Matthew?
Yeah, Gurleen, this
Matthew?
is Matthew. Yeah,
Hi.
once you sign up, yeah, how are you?
Okay.
So once you sign up for the insurance, you know, that's Colleen does the work to take your enrollment choices, set it up with the insurance carriers, and then we begin deducting the premium. You're part of the premium out of your paycheck. So as long as you're getting a paycheck, that money is coming out. If you ever dip an hour and you don't have enough money to pay for the premium, then I send you a bill and you pay me directly for the premium for that time period. But as Colleen indicated, we would allow you to go 30 days without any work before we consider you no longer an employee of ours. So our job is to keep you busy so that you don't have those long gaps. And then we would just work that out in the middle if that ever was the case.
Okay. Like another question. Can I, if I get the insurance, can I add my kids and my husband in there?
Absolutely. And you can add your kids to the medical and your husband to the dental and maybe just you on the vision. It doesn't matter. You're able to mix and match. So whatever works best for you.
And clarification on that point, Gurleen, it's only during this month that you're able to sign up anybody. You can't make changes throughout the year unless you have a significant event, a divorce, a death, a loss of employment, those types of things.
Okay. Okay. Well, if it's just going to be just me only, that will be okay, right?
Absolutely.
Okay. When can I sign up?
Right now, please.
Matthew?
Yeah, you can go, Gurleen, you can do a couple different things. You can go online and
I'm
like
not
Colleen
on access to a computer right now. I'm at work.
Okay, well, it could be later tonight. It's due by Friday. So when you get off your shift, you can go on a computer and log in that way, or when you're off your shift, you can give either me or Colleen a call and we can help walk you through it.
Okay, I can use the same 1-872-240-3412.
Well, no, it's there's a link in the email that you received, or you should have received. We've been having some issues with your email. Maybe we can talk offline about that. But
the email should be at home. I don't have it in my phone.
Perfect. Yeah, when you get home, take a look to see if that email went through. And in the email, there's a link to Employee Navigator, which is the name of the website that manages our benefits. Okay?
Okay.
Hi, my name is Joan. Hello.
Hello.
Thank you.
Yeah, hi, this is John Simmons. I have a problem. I am asking, is it 30 days? 30 days if you don't have a job. After 30 days, you're cut off. Okay, why can't you pay out of pocket until you start working again?
Well, because while you're an employee of ours, the company is paying $325 a month for your benefit. So if you're not actively involved with our company, we're investing in you, even though you're not investing back in us.
But Matthew, what if it's not my fault that I don't get have a case? How is that gonna work? Because if I don't have another job, so if I, for instance, lose my patient now, and I don't get another one for the next 30 days, what's gonna happen?
Well, if I know you well enough to know that we would want to get you on a case as quickly as possible. So we've had in very few situations, unless the caregiver does not want to work, we have had very few situations where there was not jobs available. Just recently, I've had employees that have come off their case and they have chosen to take a break. They don't want to come back on. So if they don't come back on and that 30-day passes, then they're considered terminated, and the insurance then covers to the end of that calendar month.
Okay.
So in your
well,
case, if you're motivated, if you're motivated to work, we will find a case for you so that that benefit can continue for you. Okay.
Okay. Okay.
I have to listen. Yeah, it's for me. Yeah. No, I have insurance here. Every year you have to change. Even with yours, every year you have to change.
Hi,
Did
Colleen.
anybody?
It's okay.
Hi. How are you?
How are you? I'm good. My question kind of simple. With the HMO 70 and the 54, what is the difference with the co-payment, and what is the what is the difference with the deductible? I'm not sure.
Okay. So we just went over that. If you're still unclear, I'll be happy to discuss with you on an individual basis. If you can call me later on this afternoon or tomorrow, and then we can go line item by line item if needed.
Okay. All right. So if I need to have my grandson and my dental plan, would that be okay?
I'm sorry, can you ask me that one more time?
If I need to have my grandson on my dental plan, would that be okay?
Are you his legal guardian?
Yes.
And yes, I'm going to need just the guardianship paperwork from the court, though.
Courthouse.
You're appointed as his legal guardian?
Yeah, ever since he was born, I responsible for it. But I don't have papers for you.
Okay, then you're not appointed as his legal guardian, and you cannot have him covered on your plan then.
Okay. Have to have documents.
Yeah, it has to be legally.
All right. And I can't have insurance later. Colleen, hold on. One more question.
Hi, Colleen.
Hi, everybody. I'm so sorry everybody's talking at the same time.
I'm sorry. My name is Joan again. I have a follow-up question about the dental plan.
Yep.
You said if you did cleaning or filling, the company pays for everything. Is that so?
So, meaning guardian, if you have a cleaning
or
a one surface filling on the DHMO plan, you have no member responsibility, meaning that guardian will pay the dental provider whatever they charge you. However, on the PPO plan, you are responsible in the event that you need a filling. The cleanings, no charge on the PPO, but the fillings you do pay.
Okay, because that's not the case with me. Every time I am not sure which one of the plans I have though. Every time I do a cleaning, I have to pay extra, always.
Okay. So I will be happy to discuss your particular situation offline when we can find out what benefit you have. And maybe you're having a deep cleaning and not a regular standard cleaning, or maybe the frequency is more than is covered. But we can discuss that, just you and I.
Okay, I will call you on your line. I'll call you. Thank you.
You're welcome. Any other questions?
Hi, Colleen.
Hello.
Hi, my name is Georgia Gums. I have a question for you. In regards to if you have a dependent, is there a particular plan you would suggest for someone, or you have to do it on your own?
So every single individual person's situation is going to be different. So what might be good for me may not be good for you. So that is an individual decision depending upon your situation, you and your dependents. You have to look at what's covered versus the cost to cover them. So I'll be happy to help you navigate that if you want to give me a call one-on-one.
I will. Thank you so much.
No problem.
Just a comment, Colleen, while there's a pause. I know a lot of the caregivers are calling in just using your phone rather than on a computer. So if you will check the email that you've received, the actual document that Colleen has been working through is available in that email, as well as some other information about price.
And so even though you can't see it right now on your cell phone, go ahead and check that email when you get a chance so that you can all see what Colleen's been working through.
Okay.
Perfect.
All right. Thanks, Guy. Carlene, this is Otis. I'll call you back tomorrow.
Sounds good. I will speak to you then.
Okay, thank you. Bye-bye.
You're welcome. So if there's no other generic questions, we're going to end the meeting here. Everybody has my contact information, including my number and email address. So please feel free to reach out. I am happy to help however I can.
Okay.
Thanks, Colleen.
Thank you. Take care, guys.
You too.
Bye-bye.
Thank you. Bye.